Good afternoon, everyone. I'm 𝐊𝐚𝐿. I'm the co-founder of 𝐊𝐿 Holdings. 𝐊𝐿 is an all-in-one healthcare solution, which is an innovative solution towards the public health most critical problem, which is the fragmentation of healthcare services. All of us here as patients, you've experienced the bad ways happening in the healthcare services, where moving from one service to another, it's actually difficult. Our data are very, very silos. When you're exchanging your doctors or you're exchanging your hospital infrastructures, you tend to lose all your healthcare information and you have to start all over again. It's very costly to so many people. It has actually led to the death of so many patients out of negligence. It has actually led so many patients' conditions getting more worse. So 𝐊𝐿 Rx was built, which is an all-in-one healthcare solution that actually centralizes the various healthcare services, and we aim to bring together the doctors, the tests, the medicine, the records, and the emergency services together for easy access, efficiency, and outcome. And this is a solution that saves lives for millions of Africans. We offer services like appointment scheduling, health recordings, health information, and other healthcare services like teleconsultation, telepharmacy, emergency, and the record storage. So 𝐊𝐿 is built for doctors and for patients. So health personnel who are pharmacies, insurance companies, clinic and hospital, medical laboratories, specialist cabinet, and ambulances and emergency. And for patients, we are working towards chronic disease patients, insurance customers, non-insured patients, new parents, tech survey people, and health conscious individuals. The markets for 𝐊𝐿 Africa, the market in Francophone Africa is a 3 billion plus healthcare market, and we are working towards the 1.5 billion healthcare market in 5 Francophone African key countries. And in 5 years, we are looking to have a 10% penetration rate in the market with over a revenue of $100 million. So for the past 2 years, 𝐊𝐿 was created in 2022, and we started having impact in 2023. So for the past 2 years, we were able to have 10,000 patients praising our platform, and we have 50 clinics, 80 pharmacies, 130 providers. We have a monthly returning revenue of $2,000. We are basically 5 regions in Cameroon, 5 laboratory deals to be closed yet. We've been able to raise money through prize, grant, and love money. We sum up to $23,861. We had 105,000 GTV, and we have partners like IP Investment, 𝐷𝐢𝐿, Retail, Joko Labs, Health Next Accelerators, 𝐷𝐢𝐿, and 𝐼𝐻𝐿. So for our unique selling proposition, we are working towards acquisition of strategic partnerships with hospitals and businesses who actually want their clients or who actually want their staffs to get easy access to healthcare. We are also working towards digital communication, professional referral, and our value proposition is seamless data exchange across different healthcare services. For retention, we have secured patient records, digitalized services for providers, personalized experience, exceptional customer service. For development, presently we are working towards our platform expansion to add the other different healthcare services into our system. And if in 2028, we are looking at adding predictive data analytics and scaling to other Francophone African countries and start data monetization. For our B2B competitors, we have Salvo, we have 𝐷𝐢𝐿2, we have Lapware, and we have 𝐷𝐢𝐿1. What makes us different is the fact that our system has an interoperability service where data can actually be transmitted from one healthcare system, from one healthcare solution, which is actually working to another. So hospitals don't need to be able to change their electronic health records, or they have to leave from their old services they are using. What we do is these services can actually be integrated into a 𝐊𝐴, and they can actually communicate with each other without any problem. And we also have the possibility to collaborate with public health. Our system accepts scalability and compliance to health services and advanced analytics. Our market is very competitive. In the B2B market, we have strong actors like Hospital, Home Clinic Home, FarmSavvy, Cameroun, and Non-Pharma. What makes us different from these people is the fact that our system has a secured information storage for seamless data exchange among health personnel and among patients. So our system holds autonomy for patients. Patients can actually provide access for their secondary health personnel to be able to view their past medical information. So for our patient's future, when you access our system, you can be able to choose your insurance service that you're using. You have access to health providers. You have access to schedule an appointment, order for medication, secured healthcare wallet, where you can actually save for your healthcare services way before time, and you can actually pay for your healthcare services seamlessly without any problem. So we make money in the 𝐊𝐴 with our B2B business model. We offer 8 to 10% commissions per service providers to single doctors, which are actually partners to a 𝐊𝐴. We offer $600 quarterly for advertisement for healthcare structures, analytics and reporting $200, process digitalization for healthcare providers in the insurance sector $300. For our B business model, we are using the premium service. Patients can actually access some key services for free and upgrade to standard for $5, which they can access some other advanced key services, and complete services we offer premium for $10. So to make this happen, we have a specialized team put together with 39 years of experience. Myself, Maurice Kamto, as a nurse, which has actually worked in the health sector for over 8 years plus. We have 𝐊𝐴, 5 years experience. He's our coder and our CTO. He has 5 years experience working with projects national and international. We have 𝐷𝐴, he's the customer care officer. He's a neuromarketer and a psychologist with 9 years experience, and he has been able to work with other businesses, and he has this experience. We have our compliance manager with heads regulatory processes for a 𝐊𝐴, Dr. 𝐊𝐚𝐿𝐴. She's a compliance and regulatory officer, 9 years of experience, and a pharmacist. Our advisory board ranges from a financial analyst to a global sales analyst to an information system security expert based in US, and to a technical analyst. So our growth plan for a 𝐊𝐴 2025-2026, we are working towards creating a healthcare aggregator to seamlessly put all these services together to actually work. And we provide a healthcare wallet, B2B digitalization process. We are looking at closing 3 insurance companies, 100 clinics and specialists, 30% pharmacies in Cameroun, 25% laboratories in Cameroun, 50% emergency service in Cameroun, and starting with commission, freemium, and subscription, looking at expanding to 10 regions in Cameroun with over 50,000 users. 2027 to 2028, we are looking at digitalizing more providers, maximize our API compatibility, B2B linking process, 15 insurance companies, 300 clinics and specialists, 60 pharmacies, 60 laboratories, 75% emergency services, commission, premium, subscription, and expansion to Côte d'Ivoire and Senegal with over 150,000 users. 2029 to 2030, we are looking at doing patient healthcare records to expand more patient healthcare records to work together, AI for predictive analysis, USSD ordering, 45% insurance companies, 500 clinics, specialists, 75% pharmacies, 75% laboratories, 75% emergency services, commission, and other business models, 5 more countries with 200,000 users. And so with 𝐿𝐴 presently, we are raising funds through acceleration for $250,000 to be used between operations 28%, 90% team training, and 53% marketing. Thank you so much for joining us to revolutionalize healthcare service.
Yes, I would like to congratulate you for the presentation and indeed for the vision you have for the healthcare in our country and beyond, since your target is Francophone countries. And precisely, I would like to know, why do you focus on Francophone countries where we have so many other, English speaking, including Ghana, or not to talk to Nigeria, but other countries?
Okay, the reason why we focus more with Francophone African countries is looking at the weight of our problem. In Francophone African countries, we notice healthcare data is very, very silos. So it's difficult to actually get health data in the Francophone African sector. And over 85% of their patients actually go through the process of losing their healthcare information while moving from one healthcare personnel or one healthcare infrastructure to the other. And so we decided to start by looking at this diverse set of people first, to build with them and grow with them, while in the long run we can be able to, when we are successful from Africa, we can be able to cross to West Africa.
Okay, in fact, I just don't want to insist too much, but I thought that Francophone countries is a very good target. But I thought that, you could have a look at some countries like, let's say, Liberia, which are not very big. Because I assume that maybe you have this kind of solution in Nigeria already or elsewhere. But you have some small African countries, especially in the western part of Africa, which may be interesting to you.
Okay, so we'll look into that. Thank you.
Thank you.